Hi, good evening. Today is seventh day of daily NEET PG practice session. As usual, we posted around 20 questions in our Telegram channel, and this is our Telegram channel QR code. If you wanna join our Telegram channel, please scan it, or you can also click on the link which is posted in the live chat. Okay, so if you click on the link, you will be part of our growing community of Medaffin Academy. It's a community based NEET PG preparation platform, which we don't do any selling or advertise any products in our platform. It is pure MCQ posting where the members can practice, and at the end of every day we do a live session of all the questions which were posted, how many has given correct answers, what's the percentage of correct answers for each question, and also we will share the PDF of all the questions with correct answers and explanations. Okay, so today also the drill will be the same. Every day we do the same thing. At am 8 a.m we'll start the first question. Every 30 minutes we'll keep on posting one question each, and 5:30 will be our last question. 7 p.m is the last poll ending time. Then once 8 a.m we will be doing our live YouTube discussion of all the questions which were posted. So like I said, ours is a growing channel. So please, if you are preparing for NEET PG 2026 right now, subscribe to our channel, subscribe to my YouTube channel, and also join our Telegram channel. Okay, if you are watching it live right now, you can also post this. Share this link with your friends. The live YouTube link with your friends. Yes. Let's begin today's session. So in this session, I won't be discussing the full explanations. The reason being, the time will not be there. So what I will be discussing and focusing will be for each question, how much percentage answers were correct, how much percentage of people has given it a wrong answer, and the correct answer. At the end of this discussion, if you are a member, you will get the full explanation in the form of PDF. Coming to the first question, on evaluating a 3-year-old girl with enlarged clitoris and her chromosome is 46XX was detected, what is the likely cause? There are four options, and only two options were selected by our NEET PG uh, aspirants. Out of like two options, 13% has selected 11 hydroxylase deficiency, and 87% has selected 21 hydroxylase deficiency. So this I assume is a tricky question, just a confusion between 11 and 21, and the correct answer is 21 hydroxylase deficiency. For the correct answers, for the full explanation, we suggest you to subscribe to our channel. This is our QR code, and I also posted our channel link, Telegram channel link in the live chat. Once the live session is completed, we'll post again the Telegram live channel link in our YouTube comment section. You can just click on it and be part of our Telegram channel. We are planning to reach 100 members by this weekend, and we need your support. So coming to the next question. During the period between 1 to 4 months following renal transplantation, which pathogen is most commonly responsible for infecting renal transplant recipients? Uh, Almost 100% has selected option A. Hi, CG. Thank you. Hi. So almost 100% has selected option A, and that's the correct option. So I guess this is easiest question. So there will be no confusion for NEET PG aspirants. Coming to the next question. A patient undergoing surgery is maintained on anesthesia with halogen. During the procedure, the patient suddenly developed hyperthermia and muscle rigidity. Which of the following drug is most likely implicated in this condition? Okay, the options are decurare, suxamethonium, cisatracurium, and rocuronium. Okay, four options. Almost all the options were selected, out of which 56% has selected suxamethonium and 22% has selected decurare. 11% selected cisatracurium and rocuronium. Okay, so the correct answer is suxamethonium, and it is malignant hyperthermia. So, a case of malignant hyperthermia, and halothane and suxamethonium will cause this malignant hyperthermia. Hi CG, if you are following our channel, please subscribe to my YouTube channel. If you are, if you can also join our Medaffin Academy by scanning this QR code. Coming to the next question, it's an image-based question. A 35-year-old man presented with recurrent episodes of fever with chills. The MRCP image is shown above. What is the most likely diagnosis? We have four options again, and three options has been selected by NEET PG aspirants. So 75% has selected primary sclerosing cholangitis, 12% has selected Caroli disease, and oriental cholangitis is not being selected. Primary biliary carcinoma is one of the other selected option, right? And the correct option is primary sclerosing cholangitis. Okay, and it's one of the feature of this primary sclerosing cholangitis is beaded appearance of these biliary structure like tubules. Occasionally you can see like beaded appearance here and here, you can see. Yeah. Coming to the next question, another picture based question. A 15-year-old girl presented with itchy lesions on her arms as shown. Her family history is positive for asthma. What could be the most probable diagnosis? Obviously, she has a family history of asthma, and it is dry, scaly lesions, and atopic dermatitis is correct answer. And obviously, 89% has selected it as atopic dermatitis. 11% has selected as seborrheic dermatitis. Yeah. So this is also one of the confusing questions for people, I guess. Going to the next question. A pregnant lady was admitted for pregnancy induced hypertension for monitoring and bed rest. In supine position, which of the following would be a complication in this patient? So we have four options, and aspirants has selected three options. One is abdominal aorta syndrome. Number two, option B is superior vena cava syndrome, supine vena cava syndrome, and option C is superior vena cava syndrome, and option D is ascending aorta syndrome. Okay, if you see 11% has selected abdominal aorta syndrome, 67% has selected supine vena cava syndrome, and 22% has selected superior vena cava syndrome. Okay, uh, there might have been a confusion between supine vena cava syndrome and superior vena cava syndrome, uh, and the correct option is actually supine vena cava syndrome. So it's a word play. So people may think it is correct answer, but actually it's supine vena cava syndrome. Coming to the next question, who is classified as a category 3 non-heart beating donor? Non-heart beating donor. Okay, category 3 non-heart beating donor. So we have four options again. Only two options are selected by candidates. Option A is dead on arrival. Option B is a patient who died after failed resuscitation after reaching the hospital. Option C, he is a patient who was brought dead to the hospital. And option D is a patient who is awaiting cardiac arrest in the hospital. See, obviously the correct answer is B. 71% has given a correct answer. A patient who died after failed resuscitation and after reaching the hospital. Okay, this is the correct option, and 71% has given correct answers and 29%. So I assume this is also somewhat tricky question, but like it's mostly memory based question. So what I suggest for any memory based question is you read it, you just read all the memory based questions once again, have them in one place, and just close a book, go somewhere, try to remember all the things again, then come back and read again. So spaced repetition will definitely help you to remember all these memory based questions easily. Coming to the next question, which of the following investigation provides the most accurate prognostic information with respect to predicting risk of perioperative cardiac complication? So again, we have four options. One is exercise ECG testing. Option B is dobutamine stress echocardiography. Option C is myocardial perfusion scintigraphy, and option D is coronary angiography. Okay, so two option has been selected by the NEET PG aspirants during our daily posting. 67% has selected correct answer, that is dobutamine stress echocardiography, and 33% has selected wrong answer, that is myocardial perfusion scintigraphy. Okay, this is also an important memory based question, easy question. So easy questions are like easy to get confused and mark as wrong answer, and thereby attracting negative. Okay, so obviously, like, try to read all these memory based question as fast as possible, as many times as possible, so that your brain makes sure that these things will be remembered. Coming to the next question, this is also what we are trying to do in our channel, and this is actually a promo which we had released so that our members can share with other students who are looking for some options. Obviously, we are a NEET BG based academy. Medaffin Academy is part of Medaffin ecosystem. Medaffin ecosystem is built for healthcare professionals around the world. So you being part of this Medaffin Academy, obviously you will become part of Medaffin ecosystem. Uh, in this session, like in NEET 2026, NEET PG 2026, we are planning to cover at least 1000 to 1500 PYQs in our channel, and also giving them PDFs and also question module for practice, thereby increasing their revisions just by being in the channel. In channel, we don't do any advertising, and we always try to make sure that you get best of everything from this channel. So if you want to be part of this channel, again, scan this QR code. We have been doing continuously for 7 days, so we prepare every question, and we keep them in scheduled time so that it will benefit NEET PG aspirants. So yeah, once again, please join our channel. That will definitely encourage us to work even more harder. Coming to the next question, it's again an image based question. Okay, this is an X-ray, and a young male patient with a history of motor vehicle accident is unable to pass urine. Blood is seen at the meatus. What is the most likely urethral injury? So they have done this uh, dye-based retrourethography, if I'm not wrong. Yeah, retrourethography. If you see, there four options were. Option A is bulbar urethra. Where is the injury? What is the most likely site of injury? If you see, it is meatus, right? And this has been like it went inside, and here is the injury site, right? It is the injury site. So this is penile and bulbar urethra, and this is membranous urethra. So the correct answer is membranous urethra, and 44% has given the answer as bulbar urethra, but it is not the correct answer. 56% has given answer as membranous urethra, and that's the correct answer. So this is also a tricky question. So try to be very what do you say, understand the question, observe what's there in the image. So obviously it is not in the bulbous part or penile part of urethra, so it is away from the meatus. This is the meatus, so obviously it should be somewhere in membranous urethra. Or and the most common place of injury in urethra, when it is in, like, when patient is involved in rote RTA, especially in male, is actually membranous urethra. Coming to the next question, again, it's a image-based question. 35-year-old woman presents to you with hair loss for the past 3 months. She tested positive for COVID-19 8 months ago. What is most likely diagnosis? Okay. So if you see the four options, 87% has given answer as telogen effluvium, and 13% has given answer as female pattern androgenic alopecia, and the correct answer is telogen effluvium. Okay, that's the correct answer. Tinea capitis and trichotillomania trichotillomania, they appear in a different way. Tinea capitis is more of a patchy loss of hair. And yeah, for this correct explanation, full explanation with the pictures of tinea capitis, pictures of trichotillomania, and female pattern androgenic alopecia, please follow our channel. Just scan the QR code. We will post the PDF in our channel in 1 hour. Coming to the next question, again a picture based question. Which of the following procedure depicted in the image given, like above, has been done in this patient who presented with feature of early carcinoma of larynx? Okay, so we have again 56% has given answer as percutaneous tracheostomy, and 0% partial laryngectomy, and 0% as cricothyroidotomy. 44% has given answer as total laryngectomy. So if you see, it is actually a confusing question. Percutaneous tracheostomy is done, for long-term people who are on long-term intubation, or not cancerous conditions, right? Laryngectomy is the choice if there is early stages of carcinoma of larynx, because there is no point in keeping larynx if it is in early stage. And like obviously laryngectomy, total laryngectomy involves keeping the trachea open with this procedure, and this is actually part of total laryngectomy procedure. So for full explanation, please follow our channel. Yes, coming to the next question, it's also an image based question. So today lots of image based question. I guess around 7 to 8 or 9 image based questions today. Which of the following statements is incorrect in relation to the provided image? So four options, 60% has given their answer as it represents melanocytic hematoma. 0% gave, 0% has chosen, it causes no visual disturbance, and 40% has chosen an answer, it is associated with facial angiofibroma. Fourth option is there are diagnostic of neurocutaneous syndrome. Okay, out of these four options, the correct answer is it is associated with facial angiofibroma. Option C is the correct answer, and 60% has given it wrong. So it means it's a tough question. Okay, I guess like you know you have to make sure, and the beauty of this group is like you can see how many questions has been answered wrong majorly, like majority of the people, how many majority people, I mean, you can have a trend, right? So you can concentrate on those trends, and you can improve your skills, thereby that will definitely uh, address an issue that most of the topics where most of the NEET PG aspirants are giving wrong answer. It means it's a tough topic. Coming to the next question, if anybody is watching live, if I can get a hi, that will be happy. That will be encouraging. If any like or anything is also encouraging. If you are watching it and you want to be part of our channel, this is our uh, Telegram channel QR code, and this is I have posted our Telegram channel link also in the live chat if you want. Okay, coming to the next question, another image based question. Identify the mask in the image used for patients with COVID-19 infection. This is a very simple question, and everybody has given correct answer. That's non-rebreathing mask. Okay, and yeah, so this is one of the important question and important thing which we used in emergency during our COVID, and it's a reservoir, right? Coming to the next question, it's another image based question. A woman came to physician with fever. She also complained about oral ulcer and photosensitivity. On examination, rashes were seen on face as shown in the image above. She might be suffering from. The voice is coming out, Sister Skida. Sorry. Okay, no problem. Uh, yeah. Dermatophytosis, sorry, dermatomyositis is the first option. Rosacea is second option, and systemic lupus erythematosus is another option. Okay, so the correct answer is systemic lupus erythematosus. Okay, that's the correct answer, and almost 78% has given correct answer. 22% has given wrong answer. Good. Coming to the next question. Yeah, this is the next question. A patient with schizophrenia who didn't respond to risperidone and thyroid thyroidazine, thyroidazine. Always these things are like very difficult to pronounce for me sometimes. Was started on a drug named A. After starting drug A, the patient's psychotic symptoms have improved. However, he developed excessive salivation, dyslipidemia, and weight gain. What drug could likely be the drug A? Okay, so obviously these are the side effects of the drug which were used, and then as an additional drug for this patient with schizophrenia. The options were: option A is Giprasidone, option B is clozapine, option C is risperidone, and option C, I mean, it's already risperidone. Option D is haloperidol. The correct answer is clozapine, and 89% has given the correct answer. Okay, yeah. For full explanation, be please join our group. We'll be posting explanations with answers and all the 20 questions in the group after this live session. Coming to the next question, a patient presents with hernia, medial to inferior epigastric artery. What is the most likely diagnosis and appropriate management for the same? I mean, unfortunately, this question has closed even before others has attempted. Maybe there is some issue while we posted the question. Maybe we have restricted it to a very short time. So that's the reason I guess nobody could answer. But the correct answer is direct hernia with Liechtenstein mesh repair. Okay, the four options are direct hernia and Bassini repair, direct hernia and uh, Lichten, Liechtenstein's mesh repair, indirect hernia and Bassini repair, and indirect hernia and Liechtenstein mesh repair. Correct answer is direct hernia. It's a direct hernia, and the repair which is approved, I mean appropriate for this is Liechtenstein's mesh repair. Always these spellings sometimes difficult for me to pronounce. Again, same thing. I'm practicing so that to make sure that I'll be good with these things. Yeah. Which of the follow which statements? Coming to the next question, which statement refers best to the criteria for starting an urban community health center? Same again. 86% has given answer as should have a 100-bed facility in metro cities, and 14% has given answer as no sub-district and district hospital present in the area. And the correct answer is should have a 100-bed facility in metro cities. That is the criteria for starting a urban community health center, and it should almost serve a population of somewhere around 2.5 lakh population. Coming to the next question, again an image based question. You see it's mitomycin 10 mg. The following drug is used in management of which condition? This is the question. Subglottic stenosis, uh, rhinocerebral mucormycosis. Number three is adenoidectomy. Number four is tympanoplasty. Almost 86% has given their answer as subglottic stenosis. 14% has given answer as rhinocerebral mucormycosis, and the correct answer is subglottic stenosis. Okay, I think we came to the last two questions, and I guess like today it's almost 25 minutes only. Usually we do 40 minutes, uh, but we decided to make it shorter so that people can easily go through all the answers. And for explanations, obviously, you can join our Telegram. You will get the full PDF. A 40-year-old male presents to the psychiatry department uh, with complaints of loss of interest in daily life, decreased appetite, weight loss, increased sleep, and depressed mood for last 2 months. He has a family history of major depressive disorder. He is married with three children. His wife reports that he attempted suicide last year. He has a sad effect. His blood pressure is 130. Uh, he has a side effect. His blood pressure is 130/90. His pulse rate is 80 beats per minute and its respiratory rate is 22 minutes. So all the vitals are normal. His face clinical features are consistent with major depression disorder. He is started on an antidepressant and its adverse effects are explained. Which of the following drugs causes the least sexual side effects? Okay, we have four options: fluoxetine, venlafaxine, mirtazapine, and imipramine. So four options. 14% has chosen fluoxetine, and 86% has chosen mirtazapine. Okay, and the correct answer is mirtazapine. Okay, this is the least drug with least sexual side effects. Coming to the fourth question, and this is a video based question. I don't know if you guys can see it, but this is a video based question. This is an ultrasound, and if you see, they will point an arrow at particular structure during the whole video. So you can see, yeah, that's the arrow. I mean, it is kind of circular with concentric circles. Okay, I'll read out the question because question will be not be visible maybe in your screen. A healthy 8-month-old infant is brought to emergency room with episodes of sudden severe colicky abdominal pain. Means like baby is crying. And between the episodes, the infant appears normal and lethargic. The parents reported a recent diaper change containing dark red mucoid currant jelly stool. A video of the lower quadrant abdominal ultrasound is shown above, which I have shown. What is the precise pathophysiological mechanism causing this condition? Obviously, the sign shown here is donut sign. If you see, this is a donut sign, concentric rings, right? And it is most common in young children. And the reason for this donut sign and the red currant jelly, I mean, currant jelly stool is intussusception. So intussusception is actually telescoping of proximal segment of bowel into distal segment. Okay, and my God, everyone has given a right answer. So it means this question is an easy question. Okay. Yeah, I think that's it. We have completed our 20 questions and live session also. And if you can see, yesterday also we have done our live session. This has been continuing for last 6 days, and this is seventh day, and this is yesterday's live session, day 6, and today is day 7, right? And once we conclude, we will share always the material exactly what we have, and this will be the material like for your with all the answers. Okay, so if you want to join this, um, if you want to get hold of this material, please join our Telegram channel. The link is there in our uh, chat. I'll post again, and you can also scan the QR code which is here. Just scan the QR code or click on the link, and obviously you'll be taken to our channel. Every day we will post around 20 to 30 questions, and our goal is to post around 1300 to 1400 questions, right? PYQs, so that I we are hoping that this will improve your outcomes in NEET PG 2026. And that's it. Please subscribe to my YouTube channel and give it a thumbs up, like, share, and comment below so that it will reach more people. And it is kind of encouraging for me if you join our platform. I'm happy that two people have joined just by watching our channel, and we are planning to increase the number to reach 100 members by this weekend. That's our goal. And thank you. Happy reading.